Welcome back to What Matters This Week. I'm Lauren Maloney. Joining us today is Dr. Rebecca Bell. She is the president of the Vermont Chapter of the American Academy of Pediatrics. Dr. Bell, thanks for being here.
Thanks for having me.
A lot to talk about when it comes to families and children, how we navigate this new normal, how we navigate the summer. But first of all, I wanted to get your reaction to Vermont being the first state to have 80% of the population vaccinated.
I mean, we are thrilled. If you think about where we were a year ago and where we are today, where we have more than 80% of our population above 12 years of age vaccinated with excellent vaccines against this virus, I mean, we are in a great place, and we should all take a moment to really celebrate that. It's definitely a milestone worth celebrating and reflecting on, and we all should feel safer. And in fact, we see the numbers dropping as our population has been getting vaccinated. So we know these are great, effective vaccines. And I feel so good that Vermont is leading the way in this effort. It's been a ton of work, and we should all celebrate this. I do, though, as a pediatrician, have to remind folks that we have a segment of the population that hasn't yet had the opportunity to be vaccinated. And those are all of our kids under the age of 12. So I know a lot of Vermont young people and their parents and their caregivers desperately want them to be vaccinated and protected against this virus, but they are not yet eligible. We're hoping that they will be in the fall or winter. And so for now, we ask folks to remember that, because we want young people to have a healthy and fun and safe summer. And we can do that by continuing the work to get even more people vaccinated. So right now, 80% is a great number. We should be so proud of that. But let's get it to 100%. The governor was right yesterday, and the health commissioner, when they said this is a great milestone, but we have more work to do. And they announced again about more vaccine clinics. We are not done. The virus has not gone away. And we have 20% of our 12 and over population right now. It's about over 100,000 Vermonters who are eligible to get the vaccine now and have not yet started the process. So I really encourage those folks to, now's the time, get vaccinated. Vermont doctors really want all of our population vaccinated and protected against this virus. We don't know what the variants are going to do clinically. We don't know what the fall and winter will look like as respiratory viral infection season surges. And so we want people to be protected. And if you get vaccinated, you're protecting yourself, but you're also then creating and boosting our community immunity and protecting all of those young people who want to be vaccinated but haven't yet had the opportunity.
So, Doctor, let's talk about that under 12 population. I mean, I'm seeing it too, and I know you know much more than I do. Maybe 5 to 11 years old, as you said, could happen in the fall, could happen in the winter. Do you have any concerns with that age group? You know, we're seeing some reports about these rare heart issues that some teen boys are experiencing.
Yes, so I don't have concerns about the process of younger children getting vaccinated. We vaccinate young children, we vaccinate infants, babies against really serious infectious diseases all the time. I really, really trust the process. I definitely get that people have questions and other people may not be as trusting. And so I'm here and pediatricians are here to support families think through this. I will take a moment and talk about the heart stuff that folks are seeing in the news. And that is that the CDC and the FDA are looking at reports of cases of heart inflammation, so myocarditis or pericarditis, so inflammation of the heart muscle, inflammation of the lining of the heart, that have been reported some days after usually the second dose of the mRNA vaccine. And so what these agencies need to figure out, and they're having a meeting about this actually on June 18th, is we see that those conditions, myocarditis and pericarditis, all the time. It's rare, but we see it. These are cases that I've seen before COVID, before the COVID vaccine. So, and it's usually in young males, so adolescent males, males in their 20s, women too, young women can get it as well. But that's the baseline population that usually gets this condition, typically from viruses. So they get a common virus, and then for whatever reason, they have this inflammation of their heart. And so that's sort of happening all the time. But what we're seeing is more cases reported in this population than we would normally expect to see. And that signal was picked up by our surveillance system. So we have these clinical trials that happen that look at tens of thousands of clinical trial volunteers, right? So they can pick up things that happen if they were to happen in 1 in 10,000 or 1 in 50,000. But the ongoing surveillance, which is so important and has been so reassuring, is that now we can pick up on things that happen 1 in 100,000 or 1 in a million. And so we saw this with the J&J vaccine and those very rare blood clots where that was picked up. And so there is this signal here, statistical signal, where it looks like we are seeing more cases of rare heart inflammation than we would normally expect to see. And so there's going to be more investigation to see if there really, in fact, is a causal link between the vaccine and myocarditis. If so, it looks like it's rare. And both the American Academy of Pediatrics and the Center for Disease Control really strongly recommend vaccine. We know that COVID-19 infection in and of itself can cause myocarditis. And so, so it's worth looking into this potential causal link between the vaccine and very rare cases of myocarditis. But for now, we're very strongly recommending the vaccine as having far more benefits than risk.
Dr. Bell, there are reports that many children are behind even on routine vaccinations. Is that a problem that you're seeing here?
So we did see that early on in the pandemic. We saw that last March, April, May, that we were behind in Vermont. Vermonters have done a great job getting in to see their child's healthcare provider, and so we're really catching people up. I don't know the numbers offhand right now, but we're doing a great job in Vermont. But we do want to say to all of families listening that this summer is a great time. If you haven't gotten in to see your child's pediatrician or healthcare provider, get in, get that physical in, get caught up on your vaccines. This is a great time to do that.
And correct me if I'm wrong, the COVID vaccine can be given at the same time as some other routine vaccinations?
That's right. Yes. Thanks for asking that. So that was sort of discussed initially. Should we give it separately and not give it at the same time as other vaccines? But that was something that was looked at both by the CDC and the American Academy of Pediatrics, and they really felt like there was no reason why we had to give it separately. And so you can get it at the same time as other vaccines or close to the same time as other vaccines. That's fine to do.
Let's talk about these, a bit of an increase when it comes to some respiratory issues now in children with, fewer adults are wearing masks caused by rhinovirus. Is that a trend in Vermont?
Yes, in Vermont and elsewhere in the country. So I will say that pediatricians all across the country have seen their patients have their best year in terms of respiratory viral infection. So between masking and distancing and staying home when sick, we did not see influenza. We did not see respiratory syncytial virus. We did see a bit of rhinovirus, which is a very common respiratory virus that we sort of see all year long, all the time. But certainly in Vermont and elsewhere, our pediatric hospitalizations for respiratory viral infections were way down this year. So way down in the hospital, way down in the ICU, which was great. Now, as you could kind of expect, we're starting to see an uptick in some of these common respiratory viruses. So the one that we're seeing a lot of is rhinovirus. We're sort of seeing it at a higher rate than we did all in the past year, I would say. And it can cause serious illness in children. So we are admitting children to the hospital and to the ICU with this. But it's no cause for alarm at all. It just, to me, shows me how well masking and some of the other mitigation measures worked all winter, that now we're starting to see this again. So I think we're so focused on COVID, it is important to remember that even if you're vaccinated against COVID-19, you could still get one of these other respiratory viruses, and these may most likely cause a cold. But in some people, especially young kids, it can make them quite sick. So all of the same stuff that we've been doing, washing your hands, not going to work if you're sick, not sending your child to school if they're sick, all of that works as well for other viruses, not just COVID. And thinking about masking if you have any symptoms, even if you know it's not COVID. But masking can help prevent the spread and just keep our kids and our communities healthy and safe.
I know you must have stories, but how important is it right now as we're thinking about vacations, family reunions, camps? How important is it to resume these social interactions with our kids?
I think this stuff is so important. And I think, kids have really struggled this year. It's been a really hard year for everybody. But between schools being, in some cases, remote or part-time remote in terms of sports and other activities being canceled or remote, kids need to get back to their normal routine. And we really want kids to have an active and fun and engaging summer. I think, yes, go and see your families, go visit friends, take advantage of all of the great opportunities through Vermont after school in terms of summer camps. There are tons of summer job opportunities available for adolescents who want to get out of the house, earn some money. We're really encouraging people to have a fun, engaging, and active summer. One thing that families ask me about is how do we have these conversations with other families? And so I think we've been having these somewhat awkward at times COVID conversations and learning how to navigate this. And I think it's still the same with the summer. So offering to let people know, okay, all the adults in this situation are vaccinated, the kids are not. We're gonna have the kids wear masks indoors, outdoors, we're not gonna mask the kids, and just letting folks know what your plan is, offering that information up so people can have this back and forth conversation and decide whether or not they want to attend this event. And also good to throw in there if you're sick with something else, right? So, oh, I was going to participate in this activity, but you know what? I have a cold. I'm going to hold back and not do that. And so I think having open-ended conversations is really going to help make this summer a good summer.
Dr. Bell, thanks for your insight. Thanks for joining us.
Thank you so much for having me.